Alright, so one of the exercises that I use specifically as a goal pre-surgery and then after surgery as a reintroduction to single leg squat is this lunge, which I've got a nickname the lean over lunge, to try and emphasise leaning forward and pushing your hip back. So that's two of the cues we try and give to people. So instead of being at a 90-90 posture, which is when you're at the top of the movement, this is your femur at 90 degrees to the ground and this shin at 90 degrees. We're actually getting them to lean forward more, push their hip back, and actually get their knee almost over their toe as far as they are comfortable to do so. When you first start this, we use a chair or we use some sort of pole in front of them to guide where the knee is going versus so your knee tracking, so where that's going in relation to your foot and your hip. So make sure you're not getting any or significant valgus action, which is really common. And the other thing is it really helps people get back to a single leg squat. So pre-surgery especially, this is one of the things we try and show. As soon as they can do a good functional squat down to a 90-degree level, then we start introducing this, because you can offload the amount of weight on the single leg by hanging on to a chair opposed to bench, or going down to the floor eventually with your hands on the floor. So in this position here, having a foot like that, so nice wide base of support in this activity as well. So don't have too narrow a base of support where you're almost doing an inline lunge. So you want to have a nice wide base of support and then try to get to the ground and touch the ground. So in that position there, it's almost like a takeoff position, 3-point start running takeoff position. So you can equate it to that in a lot of athletes. Nice neutral spine, and then from there it's being able to stand up and then eventually stand up into a single leg stance, and then eventually being able to go into that position with no other support on the ground or any sort of balance. So that's one of the things that we use as a goal marker for people with knee injuries, or especially ACL injuries prior to surgery.